Hi, I'm Ashley with Medical Oncology.
And I'm Tina with Radiation Oncology.
And we're here to talk about head and neck cancer, Part 2. Last week, we talked about radiation for head and neck cancer.
This week, we will discuss more about the chemo side. First, Ashley, how common is head and neck cancer?
Head and neck cancers comprise about 4% of the cancers in the United States. Approximately 14,000 people die every year from head and neck cancer.
Can you please tell me what the 5 main types of head and neck cancer are and the risk factors?
Absolutely. Head and neck cancer is cancer of the mouth, nose, throat and sinuses, and salivary glands. Risks include alcohol or tobacco use, HPV, Epstein-Barr, poor dental or oral hygiene, as well as asbestos or other environmental or occupational exposures.
Can you talk about chemotherapy and immunotherapy in the management of patients with head and neck cancer?
Immunotherapy for head and neck cancer is only used when patients have incurable disease, either recurrent or metastatic. Postoperatively, patients may need radiation and/or chemo. This depends on high-risk features that may be present on pathology. Chemotherapy is also typically added if the margins of the surgery are still positive for cancer, or if it will enhance the strength of radiation and reduce the chance of reoccurrence.
Ashley, there's many types of chemotherapy. What would be chemotherapy that's given for head and neck cancers?
The standard is cisplatin, but alternatives could include carboplatin paclitaxel or cetuximab.
If a patient is ready to receive cisplatin, how often would they get it?
If we prescribe cisplatin concurrently with radiation, they get it once a week for 7 weeks or every 3 weeks. During that time, we typically also get labs about 2 to 3 days prior to make sure they're not making the patient anemic or dropping their white blood cells. We also follow up with the patient to check on their side effects and see how they're tolerating treatment.
What are the side effects?
Cisplatin side effects could be fatigue, nausea, diarrhea, ringing of the ear, hearing loss, kidney dysfunction, anemia, low white blood cells, or low platelets. Side effects of the carboplatin paclitaxel would be very similar: anemia, low white blood cells, low platelets, fatigue, nausea, and neuropathy. Neuropathy is like numbness and tingling or a burning sensation in the extremities.
How can a patient manage these side effects?
That's a great question. Here at Ironwood Cancer and Research Centers, we're pretty familiar with the medications that we prescribe and are able to pre-prescribe medications that we know the patient may need. For example, we may prescribe Zofran or olanzapine in case the patient gets nauseous. I also typically have patients pick up some Imodium in case they get diarrhea, and of course, I always recommend for the patient to stay in communication with me and let me know what's going on. They don't need to wait until their next appointment. They can call and we can give them the advice they need. And if needed, we may have them come in sooner so we can discuss it more in detail.
I heard you say that follow up weekly during the therapy. What about after that?
After the completion of therapy, we usually follow up every 1 to 3 months for the first year, then 2 to 6 months for year 2. For years 3 through 5, we follow up every 4 to 8 months, and after 5 years remission, we follow up every 12 months. Expect to follow up for the rest of your life. At each visit, we get labs prior, including a CBC to look at your red and white blood cells, a metabolic panel to look at your liver function, kidney function, and electrolytes. Every 6 months or so, we also check your thyroid function. We may also get a CT or CAT scan or MRI depending on the location of your cancer.
Ashley, this was a lot of information. What is the one pearl of advice that you hope your viewers keep?
Talk with your provider. Tell them what's going on and ask them your questions. They're here to help you, guide you through this process.
Thank you for joining us to learn more about treating head and neck cancers.
If you missed the live Lunch and Learn, don't worry. Just click the link below and watch or share with others. Have a great day. Bye.